At this time, I would like to introduce you to our today's featured speaker, Dr. Dana Goldman. Is a university professor of public policy, pharmacy, and economics here at USC. He's also the Leonard D. Schaefer Director of the USC Schaefer Institute for Public Policy and Government Service. Prior to founding the Schaefer Institute, he built up the Schaefer Center for Health Policy and Economics to become one of the world's premier health economic organizations, ranking third globally among more than 2,700 institutes. Dr. Goldman is a prolific researcher, having received more than $200 million in funding from various sponsors, including the National Institutes of Health. He has authored more than 350 articles and has been cited more than 24,000 times. He pioneered a Netflix model for financing healthcare, where healthcare payers would negotiate fixed annual fees with pharmaceutical companies in exchange for unlimited access to specific therapeutic drugs. It is a model that caught the eye of the Biden administration, who put him in their 2023 budget proposal. He hopes this will inspire other healthcare professionals to think outside the box when it comes to addressing financial barriers to health and well-being. Dr. Goldman is an elected member of the National Academy of Medicine, the National Academy of Social Insurance, and the National Academy of Public Administration, three of his field's highest honors. He is strongly committed to mentoring students, junior faculty. He has received the USC's Mellon Mentoring Award along with several other teaching awards. I got to know Dana during at the beginning of pandemic in 2020. We served on the provost committee together. It was really Dana's significant insight that really helped to shape the operation at this university. So we were able to return to our education so we can help our students graduate on time and then get on with their professional and with their careers. So really, Dana has really inspired many of us during this process, and I'm just so grateful he can come and share his wisdom with us today. So distinguished guests, please join me in welcoming Dr. Dana Goldman to the podium.
I want to thank you, Dean Chai, for that kind introduction. And let me return the compliment by noting that the Ostrow School is extraordinarily lucky to have such a distinguished scientist and accomplished professor as its leader, hopefully permanently. As Dean Chai mentioned, I'm a health economist by both vocation and predilection. But I stand before you today, I think, not for those 300 papers, not for my academic leadership, or even my mentorship. Rather, I'm here today because Snoop Dogg had already committed to the Marshall School. Actually, that may not be. It may be that the marijuana just damaged his teeth. Sorry, is that not allowed? I'm sorry. But graduates, there's no question about why you are here. You've earned a degree from one of the nation's most prestigious dental schools. Congratulations. Yeah. You worked hard for this moment, and now you're about to embark on careers that can serve society in many ways, some of which you may not even realize. And I have both personal and professional reasons for saying that. Let me start with the personal reason. It has to do with an event that took place several years ago. I was driving near campus after a meeting with our postdoctoral fellows, and I have diabetes, and I was feeling a bit off that afternoon. I was looking forward to getting home to rest. At that point, the story gets very hazy. Evidently, I blacked out while I was driving due to acute hypoglycemia. As I slowly rolled through a major intersection, somewhat like that one right over there, I was slumped over the wheel, and it was a passing dental student who noted my distress. This student jumped into my car and pulled us both safely to the side of the road. He called the EMTs, and I woke up in the ER to hear about this heroic story. I never found out who came to my rescue that day, but I'm sure that if it weren't for a dental student, I wouldn't be standing in front of you today. So I don't know if that person's in the audience or not, but thank you all. If all of you can show the same resourcefulness and courage, if all of you show the same resourcefulness and courage as my Good Samaritan, then the world will be a much better place. But I was also invited here today, I think, for professional, not just personal reasons. I work in health economics, and with healthcare forming about 20% of our economy, the decisions made by the government can affect all of our lives. And when it comes to health policy, history often repeats itself. When I began my studies in the 1980s, the federal government was struggling to fund Reagan-era tax cuts. Medicaid, which provided insurance to the poor, was an easy target. Then, as it turns out now, the simplest solution was to kick people out of the program, and many states did that. But some states, like Oregon, tried to take a more enlightened approach. They decided they could preserve eligibility by cutting waste instead. So they established the Oregon Health Services Commission. This was Doge before there were any memes. And this Oregon Commission did something very bold. It sifted through all the thousands of services and procedures that Medicaid was paying for. They looked at transplants, cancer treatments, and, you guessed it, dental services. What they found was surprising to me, but perhaps it won't be to you. Namely, one of the most effective things Oregon can do for its residents was to fill their cavities. It turned out that dental services, dollar for dollar, yielded greater patient value than medical services like liver transplants. And that is the remarkable thing about oral health. For a modest sum of money, you can alleviate tremendous pain in people's lives. Now, I don't want to brag, but I've never had a cavity. But I've seen my wife in pain from a cavity, and I can assure you that is money well spent. Not every healthcare professional, indeed few of them, can say that. Graduates, you already know the importance of oral health, but now you can say the economists back you up. And the value of the services you provide extend well beyond our national borders. The World Health Organization recently noted that oral health conditions affect 3.5 billion people worldwide. This makes oral health disease more prevalent than virtually all non-communicable diseases. And the WHO argued that we need to provide dental interventions at schools, workplaces, and care homes, basically where the patients are. I think they should come and visit USC and see the work you're already doing in the community with your mobile dental clinics and your services that you provide here. They'd be very impressed. But despite their demonstrated value, coverage of these services is often under threat due to politics and miscommunication. Practitioners, patients, and the public really need to come together to figure out where we're going to invest our precious resources. In an age of increased distrust and disconnection, that may be our greatest challenge. So my advice to you is to stay engaged with public policy throughout your careers. Don't give up on your government. And maybe you'll take that in some of those alumni meetings with you when you go. We need your insights from the front lines of care because policy and practice work best when they go hand in hand, supported by rigorous research. Class of 2025, you're embarking on careers that have incredible social impact, and I wish you well. But I do want to give you one other piece of advice. If you see me driving on campus, get out of the way. Congratulations and fight on.